Good afternoon, everyone. My name is Rolando Lavarro. I'm the City Council President for the City of Jersey City. It's a real pleasure to have you all here. We want to welcome you into Jersey City's council chambers for this special event, special press conference today. I want to begin by, where we're just honored to be selected as the city that's hosting and kicking off the Affordable Care Act registration enrollment period. And it's a great honor and great recognition for all of the work that Mayor Fulop and the entire city has done to increase enrollments and registrations for via the Affordable Care Act and health insurance. I want to begin by introducing Jackie Cornell Bichelli. She is the Health and Human Services Secretary and the Regional Director for HHS Region 2, which includes New York, New Jersey, and the Commonwealth of Puerto Rico and the U.S. Virgin Islands. And as the Regional Director, Jackie serves as the key representative of Secretary Burwell in working with federal, state, territorial, local, and tribal officials on health and social service issues, including the implementation of the Affordable Care Act.
I first want to thank Mayor Fulop and his entire team for having us here this morning, especially Stacy and Joan. They have gone to great lengths to not only get a full room here, but also make sure that there's a whole host of services. And I'm going to thank all of the folks that are out in the foyer and downstairs doing enrollment and providing services to the residents here of Jersey City. I want to thank the police department as well for providing security today. Thank Senator Menendez, as well as Representative Payne. We're also joined by Senators Cunningham and Assemblyman Minor, excuse me. And so thank all of you for coming and being a part of this. It's very gratifying to see everybody here on our kickoff day, but we have been following each other around the state and around the region, doing sort of preparation work and education work as we geared up for today's kickoff. I also want to thank all of the enrollers who are here. So to date, just this morning, we've enrolled over 20 individuals into the Affordable Care Act, and we've got 8 or 9 more sitting and going through the process. And that's just in 2 hours right here today. So some of our enrollers that are present today are Metropolitan Federally Qualified Health Center, Horizon Federally Qualified Health Center, North Hudson Federally Qualified Health Center, SRA, who's doing amazing work throughout the state, and Public Health Solutions. So I want to thank all of them for the work they're doing here, and they're doing events all over New Jersey, doing enrollment, this morning. We also have Jersey City Medical Center and their president, Joe Scott, who's here. They've got the mobile van that's been downstairs. I'm always so excited to see our mobile vans in action, providing screenings and counseling and testing into communities. Thank you. They're also now doing EMS here. And our entire HHS team. There are many around the region who came out this morning to this big kickoff event in Jersey City. So thank you to ACF and HRSA for joining me. What I really want to express to everyone this morning is that the ACA is working. We know that we have 10.3 million individuals throughout this country who now have access to coverage that didn't have it last year. Here in New Jersey, nearly 500,000 people now have the security of health coverage. And when you step back and you think in the time of 1 year, 500,000 New Jerseyans now have that security, and what that means to them and their families, it's astounding. I want to thank so many of the folks that are in this room for the work that you all did doing the enrollment initiatives last year, and I know that we will be continue to be successful this year in increasing those numbers and reducing the rate of the uninsured here in New Jersey. People talk a lot about the affordability of the ACA. In New Jersey, 82% of individuals who purchased a marketplace plan last year received financial support to do so. That's ahead of the national curve, which is 7 out of 10 individuals receiving financial support. We also are working to make the plans more competitive by providing more options to our consumers. So we've went from 3 issuers last year in New Jersey to 5. With more issuers brings more competition. With more competition brings more affordability. We even have a plan this year in New Jersey that has a $0 deductible. So for individuals who are concerned with high deductibles, there are plans out there that gives you a zero deductible. And so we're really optimistic that more individuals will be able to come back in and re-enroll into a plan that they had if they liked it, or look and see what's new, with so many new options available this year in New Jersey. So we're very grateful for all of the work that has gone on in the community. There's a reason that we picked Jersey City. The mayor has been an outstanding partner with us last year. He has really taken strides to make sure that not only is the ACA working, but that health here in Jersey City is a priority for him and his administration, whether that's the Let's Move project, whether that's granting paid sick days to folks here in Jersey City, or all of the efforts that went on last year with the ACA. So I'm very grateful to be here. I'm very grateful for his partnership and his leadership as we work to make sure that Jersey City and Hudson County and the state and the region reduce our number of uninsured. So thank you again, and Mayor, I'd love to invite you up here. Thank you.
So good morning, everybody. Thank you for taking time out to come today and join us on this important day. I see that there are many of the partners that we worked with last year in order to really make a significant impact in the state of New Jersey and specifically in Jersey City. I want to specifically thank our Director of Health and Human Services here in the city that has led the charge, and that's Stacey Flanagan and her entire team. And I believe Joan Eccleston is here as well, who's been the point person in HHS, and she's been a tireless advocate for making sure that people get signed up. And if Joan is here somewhere, I would like to recognize you. There you are, Joan. So, you know, it's really a privilege today to have the opportunity to launch today for the entire region here in Jersey City, because last year we did take this very, very seriously, going out and being as proactive as any city in the entire country. And we were privileged at several instances. President Obama himself recognized the work that Jersey City did in outreach. We have a challenge here specifically because of the diversity of the community. It's a complicated community, but nevertheless, we had navigators in multiple languages going out door to door, business to business, making sure that people knew what they were entitled to, what the options were, and our department and city did an outstanding job. So as we start with the enrollment period today, we're looking to do it better than we did last year, learn from what we did last year, make sure that we have the ability to continue to impact the community. I would just say that what you see here today from the people that walk through these doors is this legislation. This Affordable Care Act has really impacted and changed people's lives, and it will continue to do that, and we are grateful for our congressmen and senators that have been advocates for that, and we have two of them here today that you'll hear from shortly. So without further ado, I'm going to introduce the congressman first, and then followed by our senior U.S. Senator, but we'll start with Congressman Donald Payne.
Thank you. Good morning. It's a real honor and a privilege to be here this morning on such a wonderful occasion, on a continuation of a drive that started last year, making sure that the residents of Jersey City and the 10th Congressional District and the state of New Jersey and America have quality health care. I have to admit, Jersey City has done an incredible job, and we partnered with the mayor last year and did several different forums in terms of this, and it has just made an incredible impact on the health of the residents of Jersey City. So we're just delighted to be here once again. Health care and the number of people in New Jersey without health care is the lowest that it's been in 25 years because of the Affordable Care Act. And we just want to see this continue to evolve. You know, anything of this size and this magnitude is going to have bumps in the road. But I think word of mouth and the experience that residents have had to this point is letting other people know that the Affordable Care Act is something good for them, good for their family, and good for this country. So I'm just delighted to be here once again in Jersey City and support all of the efforts behind the quality of life and making sure our residents have the type of health care they need.
It's not every day that you have a senior United States Senator visiting us in City Hall here, so I think this speaks to the importance of what we're doing today. You certainly see behind me that we have representatives from the local government sit with me on the City Council, as well as the freeholders. We have council people from Bayonne, as well as state senators, and we have a congressman, and then, of course, a United States Senator. We are privileged to have Senator Menendez representing us in the state of New Jersey, because there's probably few people in this country at that level who understand local government and what working families go through. Coming from Union City here in Hudson County, from the Board of Education to the Mayor's office to Assembly to State Senator to Congress to U.S. Senate, he has had the ability to have an impact at every level of government that we all represent up here, and for certain has a familiarity with what working families go through every single day and the struggles that they have every single day. And so we're privileged to have him here today. He's been a tireless advocate for working families. I'd like to turn it over to Senator Bob Menendez.
Well, thank you, Mayor, very much for the gracious introduction and for welcoming us back to Jersey City. I'm thrilled to be back in Jersey City. Again, I feel like I've been here quite a bit lately, because there's a lot of cutting-edge things happening in Jersey City. And I am not surprised that the mayor and the members of the council are at the forefront of making sure that the residents of Jersey City, and for that fact everybody in our state, understands that there is a gateway to opportunity to make sure that health care security can be achieved. And so, Mayor, thank you for your leadership in this regard. It's easy to say that's not my job. On the contrary, you and the council are at the forefront. And I appreciate all my colleagues in government, particularly my colleague in Washington, Congressman Payne, whose advocacy is incredibly important. And of course, our state legislators, Senator and Assemblyman, and also I know we have freeholders and others. So, as well as the regional director of the Department of Health and Human Services. When I sat as a member of the Senate Finance Committee that helped devise and write the Affordable Care Act, I envisioned that some of what we have achieved here would be the reality. When you can see a 46% drop in the rate of uninsured in our state alone, that is an incredibly important reality. Too often in speeches I would say, how is it possible that in the greatest nation on the face of the earth, that we have over 1 million New Jerseyans who have no health insurance coverage whatsoever, and many, many more who are underinsured. And so now 46% more have health insurance as a result of the Affordable Care Act. Last year, nearly 162,000 people in our state enrolled in one of the plans. And guess what? 84% of them actually qualified for financial assistance to make the plan affordable. So when so many of our residents say, well, I need insurance, but I'm not sure that I can afford it, you shouldn't veto yourself from knowing the possibility that, in fact, if you apply, you may very well be qualified for assistance that is going to make it affordable for you to realize health insurance for yourself and your family. So you need to go to healthcare.gov and sign up, or come through some of the navigators who are helping us today. And I appreciate the work of these different groups, including our federally qualified health centers that I've been a champion for in the United States Senate. They do incredibly important work, and there are several here in Jersey City, as well as some other groups that are very much engaged in creating opportunities. 279,000 New Jerseyans, in addition to those that I mentioned who signed up for a health care plan, have gained access to the expansion of Medicaid, or the Children's Health Insurance Program, both which are federal initiatives to try to ensure that more people get covered. And so that's incredibly important as well. And because of the law, nearly 4 million non-elderly individuals in New Jersey who had some type of pre-existing condition, including more than 485,000 children in our state, will no longer worry about being denied coverage because of a pre-existing condition. They had a heart ailment, or they had a birth defect at birth. No longer, under the federal law, does that create a bar towards receiving insurance. 3.3 million people in our state are no longer subjected to an insurance company's saying, guess what, you have a ceiling, a lifetime cap. And if you have a significant illness, you see how those costs grow. And if you hit that cap, you still had the illness, but once you went over the cap, the company said, sorry, we don't pay for you anymore. That was changed under the law. So an insurance company cannot say, in fact, that, well, sorry, you're going to have to fend for yourself. So these are very significant realities. Now, as the regional director said, this year New Jerseyans get an opportunity. I wish that Governor Christie had decided to have a state exchange and drive it because, you know, we all know our states better, but he chose not to do that. So we are doing this from the federal government. We have a federal exchange, and we are working hard to make it successful. But we will benefit from increased competition, as the regional director said, and more choices, 2 new health insurance providers. Growth in health care costs are on track to be the lowest on record. The benchmark silver plan in New Jersey is down this year by 2%, while people receiving tax credits on a bronze plan will see a 2.1% decrease. So even with that competition, rates are going down. There's a much improved website. You know, as a member of the Finance Committee, we have oversight over the Department of Health and Human Services, and when we saw last year's challenges, we raised very tough questions about how are you going to improve this for the next period of time. And so now, the Department of Health and Human Services has been working tirelessly to increase the website's capacity and user friendliness. So the site, when you go to healthcare.gov, it can now handle 250,000 simultaneous, all happening at the same time, concurrent users. Now that's 250,000 people clicking on the same link at the same time, not just system-wide. So if you're on one page, if 250,000 people are all on that page, they're all going to be able to get through. But you might be on this page, somebody might be on another page, so you're talking about much more capacity, a much friendlier set of circumstances. That is twice the capacity of last year's system. Additionally, the site has been streamlined to significantly reduce the number of pages a user has to click through in order to fill out their application. And for people who are coming back to the site to re-enroll or want to look, I mean, they will be automatically re-enrolled, but as the regional director said, that may not be your best deal. You should shop, just like you shop any other time to do comparative shopping. Well, even if you're enrolled the last time, and if you do nothing, you will be re-enrolled, but you should come back to the site and look at it because you might have better prices and possibly better coverage if you look at what is being offered to you today. But even for those people, if they want to come back, 90% of their information is already going to be in the site, so their job of trying to look through is going to be a lot easier. Finally, I want particularly our minority communities to be thinking about how do we get the message out there and get greater sign-up. Because to the extent that we have people uninsured, we have a disproportionate amount of those minority communities who are uninsured as a part of the overall community. For example, Latinos make 19% of the state's population. They're only about 6.7% of the state's insured. Something is wrong in that disconnect. African Americans, about 65%. There's still 35% that should be, in fact, insured. And we saw in the last round that, in fact, those who were insured for the first time as a result of the Affordable Care Act from those in other communities. So a great percent of New Jerseyans and Americans were insured for the first time. So we need to get a message out to our communities that, hey, go on to the site, because yes, Obama does care for you, and you can call it Obamacare all you want. They do it derisively. This is about creating affordable care and insurance for families across our state and across our country. And that's what today's effort is all about, making sure that more people ultimately sign up. And I'll just say, you know, when we're healthy or when we're young, we think we're invincible until the first illness comes. And that one illness, especially if it's a serious illness, can wipe you out totally. Everything you ever worked to build, everything you ever saved, your house, if you have a serious illness and you don't have insurance, it can wipe it all out. And if you have nothing and you have a serious illness, well then, you know, you really want to have the wherewithal to get the best care possible. The Affordable Care Act offers us the opportunity not to worry, to go to sleep, that we are one illness away from bankruptcy. It offers us the opportunity to make sure that if we or a member of our family gets ill, we're going to get healthy again, and we're not going to get bankrupted by it. And that's what's so important about what we're doing today. Thank you very much for having us with us.